In this video, I want to talk to you about 3 simple tests that you can do to check to see if you're at risk of knee pain. So let's go. Thanks for checking out the channel. My name's John, I'm the head therapist here at John W Sports Injury. And if you're new to our channel, then welcome along. Here what we want to be able to do is help you to understand your body in order that you can reduce or remove pain to ultimately achieve your goals. So if you think that sounds like the type of content that you want to be checking out, make sure you hit that subscribe button below, hit the bell notification, and we'll keep you updated. And a reminder that if this is the sort of content you want to hear about, hit that like button. That helps me to know, and it helps the YouTube algorithm to show that to other people. But let's dive into the content. We're going to be talking knees. Now, knees are something that if you've watched my content before, you'll know I talk about. I think it gets a lot of bad press. We all think of bad knees, but actually I think the knee joint is a joint that gets beaten up by other areas. So what I want to do today is talk about 3 simple tests that you can be doing to be judging whether you're at risk of knee pain or things that you can be doing to perhaps help or prevent that unwanted knee pain. Now, before I dive into the content of this video, I want to explain that knee pain can come about through multiple things and multiple different reasons. So I don't want to think that what we're talking about today is everything that can be related to knee pain or how to cure it. So if you are suffering with knee pain or if you have questions, I'd really encourage you to reach out and make contact with us specifically, because we're able to discuss it in an individual way for you. But what I want to do is talk about some generalized ways that you can be checking your own risk for knee pain by assessing the flexibility of the muscles that cross the knee. Now, the 3 main muscles that cross the knee or have the most direct impact on the knee would be the quad muscles, which attach over the front of the knee. The quad muscles sit on the front in our thigh area. They attach into what we call our patella tendon here, and they cross over the top of the knee. Our hamstring muscles, these are the muscles that live on the back of the knee, and they come and attach via 2 tendons on the back of the knee. And then from below, we also have the calf complex, which is made up of our gastrocnemius and our soleus muscle. But those muscles come into the back and they attach sort of from the lower aspect, but attach onto the back of the knee. So what I want to do is talk through 3 ways that you can test your flexibility of these. And if you find that you're tight in any of these areas, then you may be at a higher risk of knee pain. So firstly, how can we assess our quads? Well, the way I like to do this in clinic is to do what we often term Eli's test. Nice simple test where you lay nice and flat on your front and you take the leg that you're looking to test and you simply bring the foot to your bottom. You want to keep your pelvis flat on the floor, but the aim of the test is, can you bring that foot to touch your bottom? If you can, then that's telling us that you've got full range at those quad muscles. If you find that the foot can't reach the bottom, or you have to rock your pelvis from side to side in order to achieve that, that's telling us that there's a reduction in the flexibility of your quadriceps. So the second test that I want to talk about is testing your hamstring muscles. We do this using what we call the straight leg raise test. This one, what we look to do is lie simply flat on our back. It's important that the pelvis remains flat on the floor, and all you want to do is lift your leg in a straight line towards the ceiling. Some key points to remember here is that we want to keep our pelvis flat on the floor. A typical compensation is to lift the pelvis a little bit in order to get it a little bit further. But the other big thing that we see is the knee start to bend. Once that knee starts to bend, we're actually taking our hamstrings off slack. So don't cheat yourselves. Make sure you keep that leg nice and straight. Now, for perfect flexibility, what we're looking for is a 90-degree angle to be achieved, or what we term 90 degrees of hip flexion. If you can't reach this and you feel your hamstrings prevent this or pull back, then we know we've got a tightness in those hamstring areas. And the final test that I wanted to talk about today is what we term the knee to wall test. And this is a way of judging the amount of dorsiflexion we have, or the amount of movement that we have at our calf complex. So I find this test is best performed by being on one knee, and what we're looking to do is place our toe up against the wall, and keeping our hips nice and still, we take our knee to touch the wall. Now, the role of the test is now to find out how far away from the wall we can come before we can stop being able to do that. So we slowly look to move our toe backwards and repeat the process, inching back further and further each time. You will hit a point where you're unable to do this anymore. That would be sort of, now we find that to be too far, so we go back to the previous distance that we could achieve, and that's our max distance. We want this distance to be somewhere around 8 to 10 centimeters. That's what we term our normal range of flexibility. If you're falling short of this, then we have a tightness through that calf complex. So I hope those tests were helpful, but I don't want to stop there, because what we need to discuss is if you've actually found that you've got some reductions in those range of motion and now you're thinking, well, I might be more susceptible to knee pain, what can I do about it? Well, the good thing is, put simply, you can use any of those tests to now act as a stretch for those areas. And there are some modifications that you can do if you find those to be too difficult. So for example, with the first test, with the thigh test and what we call Eli's test, if that's too difficult for you to stretch, lay it on your side and you can then do a modified version of this stretch, which is easier to do. The key point here being that you bring that knee to be as straight as possible, but that can happen over time. Then repeat the test. So again, with the hamstring test, what you can look to do is, again, keeping the leg straight, but do this from a standing position, or perhaps even look to raise your foot onto an object. And then finally, with the knee to wall test, if you find this to be difficult in order to achieve a stretch, you can do this stretch in standing by leaning up against the wall, keeping the back leg nice and straight as you bend the front leg to feel that stretch happen. Remember that static stretches should be being held for 30 seconds. So if you found that you've got a reduction in this tightness, what I would encourage you to do is take up that stretching program. Stretching should be done little and often, so complete these stretches every day, holding them for 30 seconds. After a week, repeat those tests. See if you've made those improvements. Carry on. Keep getting those improvements until hopefully you can achieve a full range of motion. Now, I didn't want you to think that that's going to reduce any risk of knee pain or resolve any knee pain that you might be having, because there are multiple things that can happen at the knee, and it's important to make sure that you know what's individual for you. But if you found that to be a helpful general guide to be assessing the flexibility of the muscles that cross your knee, well, do me a favour, smash that like button, because then I know that this is helpful content for you. And if you've got any other ways or any other questions that you want to have, drop me a comment down below, because I'll happily look to come back to those. But apart from that, don't forget to subscribe, and I'll see you in the next video.